Hey guys, Dr. Morse, Injury Experts. So we just got an update for the rookie quarterback of the Minnesota Vikings, J.J. McCarthy. He suffered, unfortunately, a torn meniscus in his knee in the preseason, and unfortunately that required season-ending surgical repair of that meniscus. Now, like most surgeries, there are possible consequences and ramifications and complications with these surgeries. Now, the issue with repair of the meniscus is that they don't always go according to plan. Most ACLs go according to plan. That's not quite the same as meniscus repairs. They're getting better, but there's still issues, and that's what we just heard about today. As he was ramping up his rehab, he likely retweaked or tweaked a new part of the meniscus, maybe part of the one that was torn, because if you look at the diagram here, you can see that it went from, it goes from a normal piece like this to a piece that's kind of torn like that, or even worse, usually like this, and then they have to suture it back together. The issue is this white part does not heal. It doesn't have a good blood supply. Only the red outer part does. So when they put sutures in that white part, that's why they have to be so careful with it, because if it tears, doesn't do well. So my suspicion is he had a little bit of a setback in there, and they admitted in this tweet that he underwent a second surgery and then he had to have a biologic injected there. Now, translation, that is PRP, that is bone marrow, adipose, any of the stem cell lines that are an allograft, which is my specialty. This is allowing for better healing, better involvement of soft tissue and growth factors and different things that allow for healing. Now, surgery probably was pretty minimal, but they needed to go in and see exactly what was going on, maybe remove a little bit of the meniscus that was irritated, not repair anything again because that would have set him back, and then add the biologics to kind of tighten everything up and bring it together. I do not expect this to extend his timeline. I still think he'll be on track to start for 2025, assuming that's the situation with him and Darnold and whatnot. But overall, just an unfortunate little mini setback, part of the progress of these, especially with meniscus repairs. So hopefully that was helpful for a little bit of clarity. No red flags, but not completely surprising given a meniscal tear and sometimes the issues with it. But in general, hopefully a couple weeks, a month from now, he'll be back on the same road to recovery and learning, and at least he gets to absorb, being in meetings, asking questions, and being able to appreciate the game and learn from the QBs above him so that he can become a better quarterback when he is physically able to prepare and to be able to get on the field. If you like this type of content, do me a favor, smash a thumbs up, subscribe, and check out some of the other content that I created for you on the Injury Experts YouTube or TikTok.